Can you guys see my screen? Okay.
We can, it's perfect.
All right. So good afternoon, everybody. And I know that Dr. Delbon already kind of gave a brief introduction about myself, but I did want to, oh, my slides are not moving. Oh, it's moving now. Okay. So I just wanted to start by giving a little bit of an outline. So I'm actually going to start by sharing a little bit of my story. I'm going to summarize since Dr. Delbon already kind of went over a little bit of my background. And then I'm going to review factors that make the pediatric population more vulnerable to a changing climate. And then Dr. Byron is going to take over and introduce herself and summarize what the AAP climate advocates are doing across the country. So, sorry, I'll skip here. So I'm originally from Brazil. I actually grew up in a small town in the state of Rio de Janeiro. And this picture down here is from that town. So I was lucky to grow up surrounded by forest and nature, but I also got to see deforestation firsthand when I was living there, and that really had a big impact in me. So after I graduated from high school in Brazil, I went to California and I got a bachelor's degree in plant biology. And then I actually got a master's in ecology and evolution. And I worked a little bit with restoration ecology. And then I kind of switched gears and became a teacher. I was a teacher for a little over 5 years. And I taught a little bit of undergrad, but mostly kids. And I had the privilege of working outside with kids, and I was really able to see how important it is for kids' overall health, physical and mental health, to be connected to nature and to be outside. You know, we had a vegetable and fruit gardens, and it was always inspiring to see how much the kids were enthusiastic to plant and to eat from the garden. And we actually also got a grant to build a wildlife habitat area in the school. So that really was an inspiring experience for me. But it took me many years to decide to switch careers because I thought that I would have to decide between environmental health and human health if I switched to medicine, which was a childhood dream of mine to study. But I finally decided to switch careers. And during my medical school, I actually got a few reminders that maybe I am able to combine both environmental health and human health. And some of these didn't come in the best way. So I ended up going to a medical school in the Caribbean. And during my first semester, we had Hurricane Irma, which is the picture here, which was a category 5. And we were actually relocated to England. And then we came back to the island. So I got to see firsthand the effect that such a climate, like an event, a natural event, extreme natural event has on a population. And the island itself doesn't really have a good way of disposing of their trash. So they burn a lot of the trash. So this picture here, I don't know if you can see my pointer, but you can see all, the black smoke. And after the hurricane, we had even more waste that they were burning. And we would see firsthand all these patients, adults and kids, coming into the hospital, into the clinic with cough and respiratory problems. So I started to realize, that there was a big intersection and connection between the two, and then maybe I could focus on that. And then when I started my clinical rotations here in Michigan in the US, I was kind of shocked to see how much waste the hospital produces just during one surgery, or just, in one resident room, how much waste in general the hospital produces. So at that point, I started reaching out and trying to find out what other people were doing about this. And I actually connected to Amy Collins. She's, I think, the health coordinator or director of Healthcare Without Harm. And she connected me with medical students that were throughout the United States. And we were able to start the group called Medical Students for a Sustainable Future. And that's kind of where I started my work with the intersections between human health and environmental health. We were able to reuse some OR material to make sleeping bag for the homeless population here in Detroit. And then I learned about Michigan Clinicians for Climate Action and joined and have been kind of working together and trying to contribute. So I'm glad that I was able to make today work. And so that's kind of to give you some background about me. And I've been also incorporating lectures on climate change and pediatric health into my residency program. And thankfully I decided to do pediatrics. I'm really happy with my decision. And the pediatric population is more vulnerable to a changing climate. And because I know not all of us here work with kids, I just wanted to spend some time summarizing what makes our patient population for pediatricians more vulnerable to a changing climate. So according to the World Health Organization, more than 88% of the burden of diseases that are attributable to the changing climate that we are seeing occur worldwide, obviously, in kids younger than the age of 5. And so I created this chart for one of my lectures, and I just thought I would use it here. Some of the things that make kids more vulnerable, one is their exposure. Kids in general have a larger percentage of surface area for their weight, and that's because they have more fat, less muscle. So this makes them more vulnerable to heat stress and dehydration and any effects related to heat exposure. As we're gonna review in a little bit in the next slide or two, for those of you who don't remember and not as familiar, kids have a higher respiratory rate as well, and they do in general spend more time outside, which increases their exposure to pollutants. And then physiologically, kids are still growing and immature. They have immature brains, lungs, and immune system that are still developing. So that makes them more vulnerable in general. And then the adaptive capacity, just by the nature of kids being emotionally and physically developing, they don't always have the motor and psychological skills to escape situations that they might be put at due to these effects. So that table I created, and then I found a very similar kind of table summarizing what makes pediatric population more vulnerable, and that's from the National Environmental Education Foundation. So I kind of just wanted to go over really quick. So on the top here, the top row, we have exposure pathways, which are some of the things we talked about. So we have extreme weather events, we can have heat stress, worsening air quality and water quality. And then worldwide, we also are seeing a big change in food supply and safety. Vector distribution is affecting, I think, everywhere in the world, and then social factors. And then what makes our pediatric population more vulnerable, they divided into 3 areas here. There are factors that increase exposure, as I have already mentioned, and they also add to what I have said, that because kids are born to this world, that we have more pollutants, they have over their lifetime also a longer exposure. And then biological factors, I think we mentioned most of all the ones that they are talking about here. And conditions that impair their ability to adapt. In addition to their immaturity, they also, as I mentioned before, like the food insecurity that we're seeing worldwide, kids tend to be more affected by that. And then some of the health outcomes that we have been documented so far and are being studied more, adverse pregnancy outcome, longer allergy seasons, and we'll talk a little bit more, heat-related illnesses, malnutrition, stunting of growth, mental health conditions is also a big thing that we are seeing, and respiratory illnesses are a major one too. So some papers that I just wanted to highlight, we are starting to see more studies being done in even the prenatal stages. And there have been some associations of air pollution and heat exposure with increased incidence of premature birth and also low birth weight, which is itself a risk factor for kids, and then stillborn in the US as well. And then that was published in 2020, and then in 2019, they're also seeing, obviously these are all associations, but associations between exposure to air pollution and NICU admissions. Right. And then the other thing I found, I wanted to kind of just summarize some main points that we are seeing in the pediatric population. And I found this paper from New England Journal of Medicine that was actually recently published in 2022. So instead of me just summarizing different articles, I just posted their table here because they did a good job summarizing everything that I wanted to mention. So as we know, with the changing climate, we are seeing worsening air quality and air pollution. And we are definitely seeing, I even have seen parents mention to us themselves that they noticed that their kids' allergy are lasting longer because we are seeing pollens for a longer period of time, which increases the allergy season. Also, more asthma exacerbation and just even diagnosis of asthma or reactive airway disease. So we're really seeing higher incidences of that. And then here, as I mentioned, just to remind those of us who might not have seen pediatrics in a little while. So kids, their lungs are still developing well into their early childhood. It's not like they, even at the age of 10, they still have some lung development, alveolar going on. So that makes them more vulnerable. And just to review, the respiratory rate is more than twice, for an infant compared to a young adult. So they're really getting more exposure to the air pollution, which makes sense, seeing more asthma exacerbation. And then heat stress, we're definitely, I think, seeing increased ED visits during the summer months due to heat-related illnesses. We actually had a patient last summer that was calling the pediatrician just saying, she was dizzy and not feeling well. And then after talking to the patient for an hour, she was playing outside, it was hot, I wasn't drinking water. So it just emphasizes that our kids are very vulnerable to that. And then extreme weather events, as I mentioned, I experienced firsthand with the hurricane, and we can definitely see that there are debris everywhere. So kids are exposed, they can get physically hurt, and emotionally, it's very hard for them. And then some have the risk of displacement or migration, which we see a lot worldwide. And then the other thing is that I wanted to highlight is water quality and quantity. So we're seeing problems in some areas of the world with water quantity, but definitely water quality as well. And after these big storms and water event, flooding, the kids can be more exposed to waterborne infections and diarrhea illnesses. I definitely saw this in Brazil a lot. And actually speaking, I just came back from California from vacation, and they just had these huge floodings there. And I think right before I landed, I think 19 people had died from the flood. So just to keep that in mind. And then I think the rest I have already emphasized. And I just wanted to kind of end my section by sharing this video. Can you guys hear it though? You can? Okay.
I often get emotional when I can't hear it now.
Yeah, I don't know what happened. I'm trying to play it again. I don't know.
Have you checked the two little dots when you shared the screen? There are two things to make the video and the sound go quickly. It's right on the bottom. You could stop share and reshare real quickly.
See if you can hear now.
I often get emotional when I talk about families.
I don't know. I don't know why the video is stopping by itself. I don't think it's on. I can put the link if you want, or I can send it to you later and you can. Okay. Sorry about that.
If you put the link in, I could probably show it real quickly right now if people want to see it, assuming it works. And Andrea, thanks for highlighting Lori's paper and putting it in the chat. That's great. So do you have the link, Carol, or should we go on to Lori?
Sorry, I was trying to get the link, but I think you can move on and then I can show at the end if you want.
Okay, perfect. Sounds great. So Lori, you ready to share your screens? Great, thanks. Carol, thank you so much. That was really great. You're muted, Laura. Lori, you're muted. You're muted.
Can you hear me now?
Yeah.
Okay, sorry about that.
No problem.
Yeah, Carolyn, that was amazing. I just I'm constantly amazed at these people that are residents and are doing all these extracurricular climate activities. I mean, you know, I think any of us back when we were in residency, if we had 2 free hours, we were, you know, I don't know, getting a suntan, doing something unhealthy, but we certainly weren't doing climate activism. So my hat's off to all the young people. We'll call you that.
I agree, Lori. Lori, you need to put your head someplace. You're kind of going back and forth in terms of sound. So if you can just, yeah, focus in on the microphone a little bit, I think we'd hear you better.
Okay, I'll try to not move. That's hard for me.
Perfect, thanks.
So I have a little bit of story leading up to the issue with the pediatricians, but not as beautiful of a story as Caroline had. So like Lisa, Rob and I spent a lot of time, you know, lobbying and doing stuff in DC, and for a few years before we got into climate and health stuff. And like a lot of people, we were just regular members of the Sierra Club or of the Resource Council or something like that, which is fine. They do great work. But you know, over the last decade or two, people have come to realize that health providers really are great climate advocates, and we can go in with a different viewpoint than what the environmental groups have, which can tend to have sadly a negative reputation with conservative people. But we are great climate advocates. And I apologize, I'm in a Starbucks, which is really noisy, but the reason I'm here is because we were tabling up in northwestern Montana, and now we're trying to get home from the snowstorm. And listening to NPR yesterday, I heard that the Gallup polls again picked the nurses as the #1 trusted voice in America. It's been over 20 years now. Last year, we were #2. I'm not sure where we are nowadays. But people really do care about the health message, and we really are respected. And in some ways, it's not fair because I don't think we should be any more respected than other people, but we are. So we're good people to talk about climate. And all right. And of course, you all know that's why you're in MiCCA, you know, that the human health has really become the new face of climate change. That everybody out there doesn't love polar bears, so but most of them do love to have good health. And if you look at the at our nonprofits that do climate work, they're actually on any of their websites, you're going to find stuff about human health now. So even the environmental organizations are realizing that using human health gets them farther in their movement. So as a pediatrician, we're lucky, or my husband tells me that all the time, because we have this huge advocacy system already set up. You know, we're already out there advocating for seatbelts and back to sleep, back on your sleep, and bike helmets and everything else in the world. So climate has just kind of become one and more of those things. So before we even started the climate advocacy program, we were the first major medical society to have a policy statement and technical report on climate change, and the new one is due out any day now. We have a listserv where anybody can list things to the other climate concerned pediatricians. We have a federal advocacy office, and 2 of the people there work on environmental issues like energy policy, and they get asked a lot just because AAP is pretty powerful, so they get asked a lot to do testimony and that sort of thing. And then we have a state government affairs office, which can help us when we're working on state legislation. And we have this great site called HealthyChildrenorg that actually gets about 2 million people looking at it every year, which is pretty amazing. And they have allowed us to do several different articles on there on climate change issues. We were a founding member of the Medical Society Consortium on Climate and Health in 2017. So that all looks good on the surface, but I guess I got to thinking, well, what about the other 67,000 pediatricians? Because it didn't really involve many people to do those things. It was sort of a national organizational sort of thing. So backtrack just a little bit, like Lisa, you know, we did a lot of lobbying in DC, and I came to realize that if we want to think nationally, federally, or globally, we actually need to act locally. And the reason is because our legislators really didn't care what the AAP said or the MMA said or any other medical society or scientific society. At least a lot of them didn't, but they did care about what their constituents say. And so, you know, for us in Montana, they cared more that 150 pediatricians said something than that the 67,000 members of AAP said something. So it made me start realizing that we needed to focus near home. So with the Montana Academy of Pediatrics, we passed a resolution about 5 years ago on climate change and health. It was the only resolution on climate change and health except for the national group at that time. And I started thinking, you know, this is actually pretty powerful, especially if you can leverage that that statement. So, you know, it came on our website. They allowed us to put up information on climate change on our website, which is looked at by a lot of parents too. And so I thought, you know, I think it would be a pretty easy ask to find pediatricians in most of the states that might be willing to do this. So I was also at the same time was on the Council on Environmental Health and Climate Change. It sort of asked them, well, can I do this? Is it okay? I want to get in trouble. And, you know, there are hierarchies even in the Academy of Pediatrics. So it took about a year of jumping through hoops. And after all that time jumping through hoops, I decided we need to do more than just ask people to do a resolution. Let's start a program. So we started the Chapter Climate Advocates program. And we actually only have them in 58 chapters now. Someone moved from North Dakota and we're having a struggle finding another person in North Dakota. Other than that, all the chapters have advocates now. And this has been going for about 3 years. And we found all sorts of people. We found medical students who were going into pediatrics, residents like Caroline, general pediatricians, a number of researchers, a lot of past chapter presidents. And, you know, maybe a fourth of them were already involved in climate action. The others were concerned but didn't know what to do. And now all of them can have the power of the AAP behind them. So when I do an action in Montana, I can say I'm representing the Academy of Pediatrics, which has a good name. And so we started talking amongst each other and having speakers every month, which we've been doing for the last 36 months. And talking about doing resolutions in your chapter, having a committee, getting things on the website, getting things in newsletters, that sort of thing. And so the results were pretty cool. We now have 21 chapters that have a resolution. Half of our chapters now have climate committees. And 4 of them have put climate change into their annual meeting. So another thing that especially the researchers and academicians were concerned about is how to get more of this in medical schools and residencies. So there were 2 different practices in Pennsylvania and Wisconsin that did parent surveys, and they published their data. And basically they provided climate, they had discussions on climate with their parents when they came in for well childcare. And then they surveyed them as to whether or not, you know, that this was a good idea or whether the parents didn't want it or anything else. And basically the results in a nutshell were that they all, nobody left the practices, and the vast majority of them thought it was appropriate, which was cool. So a number of the academicians are working with medical schools and residency programs and doing curricula there. But we also approached the American Board of Pediatrics and asked them if they would let us do a module for maintenance and certification on climate change and health, and they agreed. So we now have the first American Medical Society board that has climate education as something you can do to continue your CME. And now they're letting us do one on what's called a quality insurance, and it's a quality assurance project on incorporating climate change education into your well child, and that should be coming out any day now. So the pediatricians, I mean, a lot of it is just like what you guys are doing as MiCCA. You know, it just depends on what people's passions are and as to what they're doing across the country. Dr. Mayer in California has done a number of interviews. She was on an Instagram interview with NRDC. Dr. Steve Goldstein in New York is our official Pediatrician, and he has a whole group of climate Twitterers amongst the pediatricians. And he also just started the New York chapter of Clinicians for Climate Action. Some of us have given Pikachu talks, and some have given TEDx talks. Dr. Ellie Perkins is a PGY2 now in Washington, and she wasn't getting her chapter to be super involved, so she ended up starting a Washington Pediatricians for Climate Action group. Hannah Salzman is a resident in Utah, and she had done a lot of writing, done residencies in writing before she became a pediatrician. So she's a really good writer. She wrote one in particular where we got people from every state to sign on, and Climate Nexus published that for us. And then Caroline's been involved with the movement with the GCCHE, the Global Consortium on Climate and Health Education, to create materials so that it's easier for schools and medical residencies to get the materials and teach climate in their programs. and these were all residents that are also climate advocates. Becca Phillips-Bourne has done a ton of things down in Emory, but one thing she's done is working with her pharmacists on sustainability. And now her pharmacists are involved with a group that one of our pharmacists in Montana started. It's an international group called RX for Climate. Again, the ones with affiliations are working to get, not just get climate change into the curriculum, but also teach advocacy. Sarah was one of our advocates as a fourth-year medical student. She ended up taking a gap year and working with the climate committees of the pediatricians in California for an entire year, which was immensely helpful for them to be getting off the ground. And Vi in San Diego is a force of nature. She's just unbelievable. Besides working full time, she goes to the beach every morning and picks up trash, and she blogs about it every single day. She wheedled her way onto the San Diego Air Pollution Control Board, which is actually a really, really big deal because it's the dirtiest city in America, I think. And she collects these climate interns. They're medical students. Most of them are disadvantaged medical students, people who want to go to medical school. And she helps them do projects related to climate with the other pediatricians. And then she's really helpful on, doing recommendations to get them into medical school and stuff. She did a badge for the Girl Scouts, and she's done 2 art climate competitions here in the last year or 2. And then a lot of people are involved with various things like what Lisa was just talking to you about, testifying or, public or oral or written testimony. And sometimes these things are harder to find. The EPA ones are a little bit easier, but like right now, the Bureau of Land Management is taking comments on whether or not to start opening up federal lands to solar as opposed to fracking, like it already is. Seems like a no-brainer. I think they're only in 7 of the big Western states. So they have a hearing in Billings, but they also have public comment online. Nevada, the pediatricians there got asked to sign on to the governor's Clean Car Standards letter. And in doing that, they were in this huge group, as you can see on the screen. And so the great thing is that now all of these other groups in Nevada, now know that the pediatricians care, and they will be calling on them more to do more action. One of our pediatricians was the retired head of the public health department in Arkansas. And so he was able to, every 5 years, they do all their policies, and he was able to then incorporate climate change into the policies there. And then we had 2 different places. One was in North Carolina, the pediatricians were asked by the Museum of Life Sciences, I think it is, to help them. They were doing a GPS mapping in regards to red lighting and extreme heat. And the people in New Jersey were asked to do the same thing. In Montana, we have a couple of small projects going right now. One was we were able to get some free books from Patagonia, and we're doing a test pilot site for Reach Out and Read. So a lot of pediatricians have a Reach Out and Read program in their office where you give out a book and talk about the importance of reading to families when they come in for well child. So they are giving out these beautiful Patagonia books to kids and seeing how it works, talking about climate in the well child visits. And so we're hoping then that we can expand that to the rest of Montana, and then maybe publish and have a good example for other places. Because there are, even though we have those 2 studies where people didn't get mad at their doctors, we still, a lot of us are still reticent to talk about climate. And then we got a really tiny grant from the Montana pediatricians, and our committee started a box fan distribution. We just have 1 provider doing it now, but with the data from her and 2 other small distributions going on in Montana, we hope we'll have some data to then get grants for larger distribution in the future. And the funnest program that we did in Montana was we got a couple of grants over the last 2 years, and we've been increasing the number of adoptees of the air quality flag program, which is usually a school. Somebody looks at the Air Now app and they put the right flag up every day flying outside of the school. And so people in the community then ask what the flags are about. And it's sort of a way to get in to talk about air pollution and health in these really rural conservative communities. So it's been a really fun project for us. And then all the things that you're already doing that Lisa, because Lisa does a ton of this, the pediatrician advocates are doing that kind of stuff too. but other groups in other specialties have started creating their own groups too, which is great. So the dermatologists, and they've actually done it under the Association of Academic Dermatologists, I think, but they started a group of their own. AAFP has not done much on it, but they did start an environmental health member interest group about 2 years ago. Even though the American Association of Psychiatry has been pretty active, at least as far as doing resolutions and putting some stuff in their journals. Some of the top psychiatrists, like Robin Cooper, who's a great friend of Lisa and ours, decided to start the Climate Psychiatry Alliance to just, again, get more action from the psychiatrists. The oncologists have done the same thing. They went outside of their organization. Then a resident in Wake Forest contacted me a couple of years ago about how we got the pediatrician thing going, and she decided she really couldn't do it within the ACR, but she's just done it on her own. So now there's a radiology group. So Lisa in Michigan and us out here dug in our heels for a long time once we started seeing that there were other states that had these health professional groups, and finally took the bait and decided to start as our group, and then eventually Lisa, her group too, just to get other people involved, because there are other great people like a lot of you that aren't pediatricians that are still great climate advocates. So after this, a lot of the work in Montana gets a little murky because we've done it together with both of these organizations for most of our actions. And as you all know, about half of the states now have clinician climate action groups. So one of the collaborations between pediatricians and the state groups was in Virginia, where they had gotten a lot of leverage to do work on energy policy because their state was super blue for a couple of years there. And once they felt like they'd done everything they could to push for the more electrification, they decided to look at transportation, and they had enough money, they got somewhere, and they had a white paper done that looked at the health burden from air pollution from vehicular emissions. And their hope is that then, as they go in legislature, that they can use this report as to the deaths and the morbidity that are associated with that to get more get them moving faster towards electrification of the transportation. In Montana, we started working with some faith groups a couple of years ago, and there was my husband and I, 2 doctors, several scientists, and half a dozen faith leaders. And we started, we had a conference 3 years ago, and then I've had one yearly since then, and we're able to start a state chapter of Interfaith Power and Light. And faith people are actually great people to align with. They've actually, in the polls, they're shown to be 3 times more likely to act on a topic when they are made aware of a topic that's a concern. So our most recent project with both with the Academy of Pediatrics and the Montana health professionals together is an education campaign. We've gotten a couple small grants, but we need more to finish the project. But we want to have outreach to both providers and patients and have it be Montana centric, because granted, there's already great materials all across the internet. And we're focusing on the 5 areas that are listed, but wildfire smoke is the one we're doing mostly right now. So we're doing some written materials, but a lot of it's on the internet. We're developing these floor banners, and that's what's on the right of your screen. We have 5 big, like 3 feet by 6 feet high floor banners, and then they're going to be on a rotating display. So any clinic or health department or hospital that's willing to host them will keep them there a month and then move them to another place. But along the way with the education campaign, we're having the first climate conference in Montana next month. We did find a few people to help sponsor, and we're really excited about that. And the day before that, we're doing a legislative education day. So in our lovely government building, we have this beautiful rotunda, and you can rent it out if you are thinking about it 2 years ahead of time. Actually, it's free, but you can reserve it. And if you feed the legislators a sit-down meal, they will come and they will sit down and they will eat, and you have their ear. So that's what we're going to be doing next month, the day before our conference. So the bottom line is, doing something makes us feel better. It's research proven by our psychology and psychiatry colleagues. And there's just so many things that we can do, both as individuals, but that's really better as a group. And so if you don't have a national group that's aligned to do this, doing it with MiCCA is super within your state, because again, your legislators care about it. And if you look at drawdown.org, they have the 100 most effective issues in the United States that can bring down emissions. And I don't know a single medical group that's working on refrigerant management, even though it's listed as #1. Our daughter worked in Mozambique in the Peace Corps doing women's empowerment. So she was super excited when she found that she could combine her passions of women's empowerment and climate change into the same bucket, because look at #6 and 7, educating girls and family planning. So the bottom line is there's just a ton that we can all do, and you do have more power when you have a group behind you, like you do with MiCCA. So thank you very much. Sorry for the noisy background.
No worries about that, Laura. You're such an inspiration. I just don't know how you have that energy. Both of you are. It's really wonderful. I could give it a shot real quick to share the video, and if it doesn't work first time, we'll just go on right to questions. But we'll give it a quick shot. It's about 3 minutes, and it looks like it's really excellent. So
I often get emotional when I talk about families. It is such a privilege to work with them and learn from them and look at how they care for their children and how they try in all kinds of circumstances to make the right decisions. You know, children are not just little adults. They breathe more, they respond more to heat, they're on the ground picking up things and putting it in their mouths, and their immune systems are still developing. So we must ask ourselves always, how are the children? We as pediatricians are tasked with caring for one of the world's most vulnerable populations, and now we're faced with a new challenge, climate change. This is something we can see and often see every day. It's real and immediate, and though we might not recognize it, climate change does affect our patients. When a child comes to the office for a well child visit, we notice issues. For example, a young child with asthma might have more frequent asthma attacks as a direct result of longer allergy seasons and poor air quality. And when children experience displacement or even shelter insecurity from their homes due to extreme weather events, their mental well-being is often affected. As pediatricians, it's our responsibility to speak out on climate change. In 2007, the AAP was the first medical organization to release a policy statement on climate change. Since then, through education, policy, and advocacy, the AAP has worked to address the defining health issue of our time by empowering its members and families with the knowledge and tools necessary to make an impact. Now is the time for us to come together and enact great change. Here are some things that you can do to help. Educate yourself and others, including peers and our patients. Get involved by participating in climate conferences or attending webinars, or even joining perhaps a climate committee. Lead and serve as a role model by reducing energy consumption where you work, live, and play. When seeing patients at their well child visits, use anticipatory guidance as a framework for discussing climate change with families when it's appropriate. Together, we can advocate for local, national, and international policies that reduce greenhouse gas emissions and strive towards achieving a 100% clean energy future. To amplify its voice, the AAP is partnering with Climate for Health, a program of EcoAmerica that empowers doctors, nurses, and other health professionals to lead and advocate for climate solutions. Through our partnership, we are providing pediatricians with information, tools, and resources to help us all learn about, talk about, and lead on climate. Together, we have great power. When we ask ourselves, how are the children? We as pediatricians must be doing everything we can to answer positively. By leading on climate change, we are securing a bright future for our children. Please join us.
That is awesome. I'm really glad we took the time to look at that. That's really moving. Who's a pediatrician? I don't know her. Laura's trying to tell us. You got to unmute.
She was one of our head honchos. I think the chief medical officer for AAP. She just retired last year.
Oh, okay. Well, great presentation, you guys. Let's open it up for questions.